Hello and welcome to PM Express right here at the Labadi Beach Hotel, sat at the Lagoon Bar. It doesn't happen often, so we say thank you to Labadi Beach Hotel for allowing us to have this all-important interview here. What are we talking about? We're talking about all things health. We're looking at Tramadol, we're looking at the abuse of alcohol, self-medication, we're looking at innovations in health, we're looking about health equity. Indeed, we are talking health, which means we are talking life. My name is Nana Nsakwa IV, Chief of the very little Republic of Akomo, Edumasa. And when I come back, I have a very fine gentleman who is very passionate about health. And we're going to jojo and share ideas, and hopefully those who have ears will hear. Don't go away, we're coming straight back. Well, thank you very much for staying. My guest today is Dr. Gabriel Bananku, who is the president of the National Coalition of Health NGOs in Ghana. He's doing a great job putting all things together, ensuring that there's equity all over, so that in your remote area you may find a good nurse, a good doctor. Either way, health reaches you rather than you chase health. Doctor, thank you so much for your time.
Thank you. You're blessed.
Thank you. Doc, we want to start with Tramadol, where all of a sudden, I'm sure it's been in the system for a while, but all of a sudden, the sudden abuse of this drug, Tramadol, and the youth, you know, what's the NGO's position and how do we curb it?
Yeah, thank you once again. And thank you for your crew for having me and welcome me to be here to share the perspective from the civil society and also as the think tank and influencing umbrella organization. Our role is to complement government effort in ensuring that everybody is safe in the country, everybody have the best quality care in their country as mandated by the 1992 Republican Constitution. And let me also say that I am not the PRO of the Ministry of Health, Ghana Health Service.
Okay.
But the Constitution allows us to constructively make input for the development of the country, and more especially the health sector. The Ministry of Health is the official ministry or body that initiate policies, that formulate policies to ensure that everybody is protected and everybody have access to health. The Ghana Health Service does the implementation. So we come in as a catalyst. So what we do is to be part of the policy implementation, be part of the activities implementation with the Ghana Health Service, and also to give a perspective of how we feel about what is happening in the country. Now, recently, there has been a lot of issues on Tramadol. Actually, Tramadol is a special drug. It's not supposed to be taken by everybody.
Okay.
It has a specific specification, and it's supposed to be issued by specific people for a purpose. And so, the recent happening around the country is very alarming. Before I met your crew, I had already sampled the whole country to find out what is happening. And it is sad to say that all the 10 regions are using Tramadol wrongly.
Wow.
And more especially on the youth. But specifically, when you wrongly take Tramadol, it has a lot of effect. Tramadol is supposed to be given to people who have severe pains and who have specialized condition that they are unable to cope. And so when the specialist sees from diagnosis that it is the best option for you, don't forget that every drug has an effect.
Okay.
But if it is the best option for you, then it means that you are put on it for a specific period of time. It is not supposed to be a regular therapy. It is not supposed to be, excuse me to say, water that we drink every day. It's supposed to be on specific time. And the pharmacist will tell you the side effect if you continuously taking it. And so when we heard about this, we started educating the public. And thanks for giving us the opportunity to continue our education and advocacy on how Tramadol should be used or should not be used. It disorganizes the whole body if you are not instructed to take.
Wow.
What it does means is that it can retard your mental faculty, so you will not function well from time to time, which is very serious because young people are taking it now to do work. Young people are taking it and they claim it is
Aphrodisiac.
it helps to function well on bed. But let me put it on record. As a practicing mental health officer, I think that people have wrong information about Tramadol.
Wow.
It is very, very wrong that people take Tramadol because of sex. Honestly, you are not supposed to take any medicine or drug to have sex. You are rather supposed to be psyched if you have dysfunctional issues with having sex or enjoying sex. There's a psychotherapy intervention that especially can take you through. A counselor or a clinical psychologist or even a psychiatry can take you through to be able to overcome the dysfunction so that you can function properly, to enjoy sex in your relationship. But you are not supposed to take an extra medicine or drug before you can function. So you have a lot of effects. Now, it will help you to be taking it progressively, and that can affect your general body, your kidney, your heart. In fact, the whole body can be affected.
Doc, the higher doses that have been found on the market, because I haven't seen, but in the news, I hear there are really higher doses now on the market. Have your sources found out who's importing them and if they can be, arrested or stopped?
Yes, in fact, that's what I was just coming to hit. The drug industry, excuse me to say this, but we have to hit hard. The drug industry, sometimes there are cartels, very strong cartel, and sometimes they maneuver their way, they bulldozer their way into a country, and they bring in unnecessary drugs which are not even prescribed by the country. For example, Tramadol. How has the Ministry of Health, Ghana Health Service, endorsed it by the WHO prescription? Before you can use some of these drugs, you would have been recommended, and you would have asked for that you would need it in your system, and that it will be regulated. Now, in Ghana, we do have challenge of regulating our drugs regime very seriously. Currently, government has reduced the tax rates for medicine, which is better, but the alarming issue that is growing is that it could create the opportunity for people to bring in more unregulated drugs. So we need to watch out. The Food and Drugs Authority is the official body in collaboration with the Ghana Standard Authority. Unfortunately, and we have to be very sincere, they have not been supported adequately to play their role. We have the Local Government Act, and the Local Government Act mandates government to decentralize every agency in this country so that they can complement the local government at the lowest level in terms of supervision, in terms of regulatory checks, in terms of initiating policies. And Food and Drugs Authority is actually supposed to be decentralized to all the 216, now 255. So you are supposed to have Food and Drugs Authority in every district. The Parliamentary Select Committee need to look at this and amend the law so that we can have Food and Drugs Authority in all the districts. In addition to the Ghana Standard Board, they are also in the same crisis. They are not being supported adequately, so they are not able to enforce standard. So yes, there are unregulated high levels of doses around in the market. And the question we ask is that, what is Ghana guidelines on tramadol? What type of specification have we endorsed or agreed that it should be sold within the market? What has been the role of the Pharmacy Council? Because they dispense by law, that is their responsibility. What is the role of the chemical sellers? By law, they are not supposed to dispense some of these drugs. But the young people or the people who patronize tramadol now always get them from the chemical sellers. Yeah. So who enforces the law? Who check? Who supervise? And that is a very critical issue that the Food and Drugs Authority really need to do. Two, the law allows them to educate. The law allows the Food and Drugs Authority to educate. If not because of these incidents, I haven't seen the Food and Drugs Authority proactively educating people about what to look out for on drugs, what to look out for if you want to take, what to look out for if you are sick, what to look out for when you see medicine or water in your community. What are the simple indicators that one need to have or know so that you can be able to help them to track down illegal intruders of the drug industry? That also needs much more to be desired. The third issue is there should be a collaboration between the National Health Insurance and the Food and Drugs Authority. You know the reason why, Nana? The reason is very simple. When the Food and Drugs Authority is not able to collaborate well with the National Health Insurance to collaboratively educate the general public, people will abuse the drugs and they will get sick, and we admit them, and they will overspend at the hospital. The National Health Insurance will have to pay or reimburse the service providers. So the vicious cycle of the National Health Insurance will continue to exist until we coordinate and collaborate for value of service delivery. And that's why I'm drawing the attention that there's that critical strategic need for the Food and Drugs Authority and National Health Insurance to begin a collaboration so that they can put their resources in a one basket and educate the general public for minimal abuse of drugs so that we can make more savings from the National Health Insurance.
Let me pick you up on being proactive.
Yeah.
Now we're all worried about tramadol. But we seem to turn a blind eye on excessive alcohol consumption, which seems to be a bit on the high side.
Yes.
I've spoken to a couple of doctors who said, the kidney and liver problems are coming, and it's all due to excessive alcohol intake. I mean, should we start the campaign now, or should we wait until, I don't know when?
Yes, if you look at the the WHO, the World Health Organization assessment in collaboration with the Ministry of Health, Ghana Health Service on disease burden, non-communicable disease burden, you see that Ghana disease burden on non-communicable is increasing even more than HIV as we used to. So what it does mean is that it can quadruple in 10 years' time if we don't do something about public health, if we don't support the health promotion unit of the Ghana Health Service, if we don't support the district public health. Now, what it means is that we need to educate people about what they take. Now, in secondary schools, they are beginning to use drugs and alcohol. And in Ghana, popularly, we have what we call laka. Laka is a combination of the Indian hemp, weed, and the local gin, plus what they put there, either they put onion or garlic and other herbs. Scientifically, if you put the alcohol, if you extract the alcohol and you put the wee ingredient, active ingredient, and you mix, you see a reaction. And that reaction is the same thing that reflects in your stomach when you take them. What it does means is that we are cultivating kidney crisis in this country. What it does means is that we are supervising hypertensive situation in this country. What it does means is that we are creating the opportunity for complicated diabetes. And what it also means is that it's a bane on the national economy, because we will be spending more money in treating these complications at the various health facilities. So there is no need for the alcohol industry to continue this agenda, which is also against the Public Health Act. They advertise it wrongly, and sorry to say this, the media sometimes also unnecessarily and unable to check the efficacy of some medicine or drugs, and they put it on their network. And they even have a way of speaking to it that you will be so enticed with it that you will want to even try. So I think we need a legislative instrument on the Public Health Act. Ghana has a Public Health Act, 2012. What we need is to develop the legislative instrument so that there will be an adequate funding for public health education. The Ministry of Health will have to make a case for Cabinet to initiate the legislative instrument processes so that the Ghana Beyond Aid, as our president have been saying, becomes a realization if we begin to domesticate our own way of regulating our health system, our drug regime, and supporting local initiative in a very safe and conducive environment. We will be able to make progress in that. Otherwise, we will be pulling down the health system, and that will mean we will not be able to move away from our transitional arrangement in the health sector.
I mean, maybe it's not the right question for you, but is there any way of extracting the herbs without putting alcohol, or should it?
Yes, scientifically, there's a way of extracting the active ingredients from the herbs
without necessarily putting alcohol.
Without necessarily putting in the alcohol. But when you put the alcohol, I'm not a chemist, but I'm a biologist. I've studied biology, chemistry before. When you put the alcohol in the weed, as they popularly call it, you will see some reaction. I've experimented it.
Okay.
I've experimented it. So I know, as a public health advocate, when we hear something in the public, we try to experiment.
Okay.
You will see for over 12 hours. Honestly, when they put it immediately, they don't take. They put it for at least a day. So within the 12 hours...
What does it, bubble, fizzle?
It bubbles, you see certain reaction, and it even absorbs all the alcohol. You have to put it 2-3 times before you can use. What it does mean is that it is poisonous. Wow. That's the initial observation. Scientifically, it is poisonous. Now, you don't know how much alcohol should mix with the weed. You don't know how the quantity of the weed that should be mixed with a particular quantity of alcohol. So it means we are doing it randomly. So that is unscientific. And the human being system works in a very normal formula. Your weight, the water level, your blood level, your mucus level have to be determined before something is given to you. And so when you jam all these processes and you take in a foreign material, the immune system will begin to fight until it gets tired. Until that, when you are addicted, the alcohol will then decide for you what you should do. And that is one of the issues why we are asking for the legislation on the Mental Health Act. The LI is not also passed. When the Mental Health Act, when we have the LI, it will also help government to bring out psychologists, clinical psychologists, psychotherapists, and psychiatrists in all the districts in Ghana, including the sub-district. What it does mean is that these specialized, trained people will be able to detect early warning signs of alcohol abuse. They are also trained to know how you can treat alcohol abuse without taking medicine.
Self-medication, maybe, is it just a problem or is it worldwide? Because we seem to...
It's worldwide, but countries have been able to regulate it. The Netherlands have been able to regulate it. The Germans have been able to regulate it. Even the Americans have been able to regulate it.
Because we seem to...
But in Africa and for Ghana, because our health systems are not very robust, because our public health system are not very appealing, we do not have enough information. And so distance of the health facility, absence of the specialized person to talk to, brings out people to initiate their own treatment. And that is why you see a lot of complications now. Even the pregnant women, where they are not supposed to self-medicate, but sometimes they have no option than to self-medicate. Otherwise, they don't have somebody to talk to. I mean, maternal mental health is there. People go through depression. They are not supposed to take paracetamol when you are going through depression. You are supposed to be supported psychosocially. You are supposed to be taken through certain processes, not to take drug. Because when you take drug, you get used to it. You self-medicate, so next time you go back to it. But where are the psychiatrists? Where are the clinical psychologists? And where are the counselors? At the various health facilities, community level, the CHIP compound is supposed to have such people. We need to have it at the district level. We need to have it at the regional level. We need to have even regional psychiatric hospitals, so that when the situation is even much more higher, we could have treatment there. So that is because of inadequacy of our health infrastructure and human resource. It brings a gap between the people and the service provider, and the only way they resort to is to self-medicate.
Well, I cannot definitely have to touch on World Malaria Day. What was the theme this year?
The World Malaria Day actually is a day by WHO, UN, to ensure that every year we recognize every body in the country. Because as it shows that everybody in every country at least visit health facility for malaria at least twice a year. And in Ghana, if you pick the attendance ratio of people out of the over 29 million, you have about 30% patronizing malaria treatment annually, more than 2, more than even 3 times. What it does mean is that it's a burden to our economy. So this year, World Malaria Day was celebrated in Cape Coast by the civil society group, and the coalition was also there. And yesterday we issued a statement. What we are saying is that Ghana is doing well in terms of malaria control and prevention. We have even developed vaccine that the Ghana Health Service is introducing in certain regions, and after that it will be scaled up.
That will make you, like you inject and you don't get
exactly. So it's a kind of vaccine.
Okay.
So which vaccine saves, and vaccine helps every country to develop. Because when you are able to prevent, Public health will tell you if you prevent, it's costly to prevent, but the effects of prevention is much more greater economically. You have very robust, high-performing human resource. You have very robust health system. You have very robust infrastructure because you save more money to do infrastructure. So Ghana is almost there.
Doc, let me break it down. I mean, when you say vaccine, like polio vaccine, tetanus vaccine,
yes,
that like
yes, it's
prevents
similar.
you?
Yes, polio vaccine, you know, expanded program for immunization now is introducing about 13 or so vaccines in one or concurrently. What it means is that we used to have 5 killer disease, became 6 killer disease, now there are 13 preventable childhood diseases. And any of them could kill a child if the child is not prevented.
So how would the vaccine? I'm quite interested.
Yes.
Is it once in a lifetime or every 10 years you go and booster?
For the expanded program on immunization is from day 1 till your 5th year. So there are so many.
No, I'm talking about the malaria vaccine.
Oh, the malaria vaccine.
Yeah.
I've yet to know the recommended one from
okay.
WHO. But for Ghana, the Ghana houses have finished the pilot studies.
Okay.
I think Kintampo Health Research is one of the pilot sites.
Okay.
They have done the trials. It's confirmed. The efficacy is okay. And they want to start with the integrated with the expanded program on immunization. So, you know, targeting children, every year Ghana gives birth to over 1 million children. And so targeting children will be the best way to prevent children from malaria, because children die of malaria higher in the country. So the malaria vaccine is supposed to help prevent, so that you don't, as long as you are on it, you will be resistant to
malaria.
any malaria parasite.
Let me take a break here, but that's news.
Yes.
That's news. But when I come back, before I move on to other issues, I want to find out if we are still building open drains and still leaving rubbish, open places and vaccinating ourselves against malaria. Are we just trying to annoy the mosquitoes, coming straight back?